Cellular reaction to injury. One of the first signs of almost all cellular injury is the presence of cellular swelling, which occurs when cells are unable to maintain the proper balance and concentration between ions and fluid levels, which is the basis of osmotic pressure. The balance between cellular fluids and ions can be explained through the analogy of a tropical aquarium. Tropical fish can only survive in salt water that has the correct balance of salt and water for the specific species of fish. Additionally, there must be an adequate total amount of salt water in the tank. If the tank is only half full, it cannot support as many fish. In a similar fashion, cells react to changes in their environment by altering both the total quantity of intracellular fluids and ion concentration within that fluid. Osmotic pressure is defined as the pressure that develops when two solutions of different concentrations are separated by a semi-permeable membrane. Osmotic pressure is defined as the pressure that develops when two solutions of different concentrations are separated by a semi-permeable membrane. Osmotic pressure varies with concentration of the solution and with temperature increase. Human cells have an osmotic pressure approximately equal to that of the fluid in which they circulate. Example, blood, lymph, cerebrospinal fluid. Solutions exerting the same osmotic pressure as that within the cell are said to be isotonic. So solutions exerting the same osmotic pressure as that within the cell are said to be isotonic. Solutions with a stronger osmotic pressure than the cell are called hypertonic solution. Remember hyper, like a hyper child? And solutions with a weaker osmotic pressure than the cell are hypotonic. A cell placed in a hypertonic solution will shrink, while a cell placed in a hypotonic solution will swell. The shrinkage of a cell placed in a hypertonic solution is known as crenation. Arterial embalming fluid affects cells in a similar manner. Desiccants are hypertonic embalming fluid solutions that remove excess moisture from the tissue, while humectants are hypotonic embalming fluid solutions that add moisture to dehydrated tissues. Cellular swelling. When an entire organ or tissue experiences cellular swelling, there is a loss of color or pallor, and the cells become distended, turgor. It is important for the embalmer to note that cellular swelling cannot always be removed during the embalming process. Cellular swelling is usually reversible when the cell recovers from the injury. For example, like mosquito bites. If the person dies, cellular swelling will persist, causing disfiguration. Fatty degeneration. Another form of reversible changes that cells sometimes undergo is fatty degeneration. Fatty changes occur in cells due to the accumulation of triglycerides, which are the result of three hydroxyl groups of an ester reacting with fatty organic acids. Basically, triglycerides are the result of the digestion of fats. Fatty changes often occur in cells nearby dead cells. Fatty changes may be present in cells of the heart, skeletal muscle, kidney, and other organs. Possible causes of fatty degeneration includes toxins, protein malnutrition, diabetes mellitus, obesity, and starvation. The most common cause of fatty change in the liver, however, is alcohol abuse. In severe forms, fatty changes may precede cellular death, although cells may die without undergoing fatty change. Amyloid degeneration. In certain diseases, cells undergo amyloid degeneration. Amyloid is a waxy, translucent, complex protein that resembles starch. The process of amyloid degeneration is sometimes called waxy degeneration or Lorsidius degeneration. Amyloid degeneration may occur in certain cancers, chronic inflammatory diseases, chronic renal failure, Alzheimer's disease, and type 2 diabetes. Infiltration. Cells can also be changed through infiltration, which is the process of seepage or diffusion of a substance into tissues that should not normally be present in the cells. Infiltration occurs prior to cellular swelling. Cells undergo pigmentation when they become infiltrated with pigments. Pigmentation is defined as the coloration caused by either deposit or lack of colored material in the tissues. Exogenous pigments are colored substances that come from outside the body. Exogenous, outside. while endogenous pigments are colored substances that are synthesized within the body. Calcification. A wide variety of diseases results in a common process within injured cells known as calcification. In all cases of cellular death due to necrosis, calcium deposits are present. Calcification implies the depositing of calcium salts, magnesium, iron, and other materials within the cells. Calcification of the lymph nodes present in cases of tuberculosis can actually turn the lymph node to stone. The embalmer will most commonly encounter calcification of the arteries. In cases of atherosclerosis, fine white granules or clumps that feel like gritty deposits are present in the arteries. It may be impossible to introduce the arterial tube into the artery for the injection of arterial embalming fluids due to the process of calcification. Gout. Gout is a common form of arthritis that causes swelling and pain in some of the body's joints. In particular, gout typically affects a joint in the big toe, but it also affects other joints of the feet and ankle, as well as other parts of the body. Gout is a disorder caused by the accumulation of excess amounts of uric acid in the tissues. So an excess amount of uric acid in the tissues. Uric acid is a chemical that is a natural end product of the normal process of purine metabolism. In other words, the body breaks down foods and builds up tissues by utilizing chemicals that naturally form uric acid in the body. When excess levels of uric acid are found in the blood, the condition is referred to as hyperuricemia. Uric acid is normally dissolved in the body. However, the presence of excess levels of uric acid in the blood can lead to the formation of microscopic crystals that infiltrate the tissues of the joints. The presence of these uric acid crystals, which are technically known as monosodium urate crystals, causes the inflammation of the joints and the pain, swelling, and loss of function of the affected joints that accompanies cases of gout-related arthritis. Cellular death. Necrosis is a sequence of structural changes that follow cell death in living tissue. All dead cells are not necrotic. Tissue placed in a specimen bottle and treated with a fixative is dead, but it is not necrotic. The process of necrosis includes cellular swelling, changes in the nature of cellular proteins, which is known as denaturation, and the breakdown of cellular organelles. The morphologic changes in necrotic cells are the result of two concurrent processes. The first necrotic process is the denaturation of cellular proteins. Proteins are denatured when their molecule structure is changed due to heat, radiation, pH changes, or other mechanisms that destroy or diminish their original properties. For example, as heat is added in the process of frying an egg, the proteins in the egg are denatured. Caseous necrosis, like Caseous, necrosis is a distinct form of necrosis present in cases of tuberculosis. The term caseous means cheese-like, and the center of caseous necrotic tissue has a cottage cheese appearance. Caseous necrosis is characterized by a pink area of necrosis surrounded by inflammatory granules. Gangrene is a term commonly used to refer to several types of necrosis. Wet or moist gangrene is a form of liquidative necrosis that results from bacterial or fungal infections that develop in areas of dead necrotic tissue. The tissues become swollen, discolored, and blistered. When accompanied by gas, gangrene, wet gangrene may exhibit a crackling sound known as crepitation when it is touched due to the presence of gas in the tissues. Clostridium perfringens, which is described in greater detail in part 2 of this book, is a gram-positive endospore-forming bacterium that causes gas gangrene. It causes the fermentation of carbohydrates in the tissues, releasing carbon dioxide and hydrogen gases. The toxin produced move through the swollen tissue, causing further necrosis of neighboring tissue. Gas gangrene is often fatal, spreading throughout the body via the blood. Ischemic gangrene, which is also known as dry gangrene, dry gangrene, occurs when tissues become dehydrated if the blood supply is reduced. It may occur, for example, in the leg if calcification of the arteries is present in the form of arteriosclerosis. The tissues become black, dry, wrinkled, and greasy to the touch. There is also a clearly defined line of separation between the dead and healthy tissue, and there is no infection present. Ischemic gangrene is not uncommon in deaths related to diabetes mellitus. Adaptive responses to cellular injury. Although cells are in constant state of change in relation to fluctuations in their environment, there is a middle ground between the normal, unstressed state of a cell and the overstressed state of an injured cell. Pathological changes in cells are adaptive responses that deviate from the healthy state but allow the cell to avoid injury by altering itself or its environment. There were 4 adaptive responses to cellular injury: atrophy, hypertrophy, hyperplasia, and metaplasia. There were 4 adaptive responses to cellular injury: atrophy, hypertrophy, hyperplasia, and metaplasia. Atrophy is the shrinkage in the size of the cell by the loss of cell substances, as illustrated in Figure 3.1. Atrophied cells are not dead, they are an attempt by the cells to adjust to available resources. As the demand placed on cells decreases or their supply of required resources is reduced, they shrink through the self-digestion of cellular components. There are several causes for this. Cells atrophy during convalescence after recovery from a bone fracture, or when workload is diminished during healing. Perhaps an injury has diminished the blood supply to a limb or a nerve and has been damaged, resulting in paralysis. In both of these examples, pathological atrophy would occur in cells. Atrophy need not result from injury, however. The body's workload is drastically reduced for most people as they age. As people become less active and more sedentary with age, the workload for cells is reduced and the cells shrink. When atrophy occurs as a result of age or more sedentary lifestyle, it is referred to as physiological atrophy because it is not accompanied by a pathological condition. Makes sense. Hypertrophy. Another form of cellular adaptation is hypertrophy, which is an increase in the size of cells and consequently an increase in the size of the organ or tissue. In pure cases of hypertrophy, there is no increase in the number of cells. The cells are just bigger. There are 3 types of hypertrophy: physiological, pathological, and compensatory. Bodybuilders exemplify physiological hypertrophy through weightlifting. Pathological hypertrophy occurs when cells have been damaged. For example, a myocardial infarction is a heart attack in which a portion of the heart muscle actually dies. To compensate for the loss of viable cardiac muscle tissue, the remaining cardiac cells may individually increase in size to compensate for the dead cells. Hyperplasia. Hyperplasia is also an increase in the size of a tissue or organ. However, it differs from hypertrophy in that there is an increase in the number of cells present, not just an increase in the size of individual cells. Hyperplasia and hypertrophy often occur in unison. For example, cells in the tissues of the female uterus both increase in number and in size during pregnancy. Hyperplasia can be either physiological, compensatory, or pathological. Physiological hyperplasia is the result of normal growth. For example, the increase in the number of glandular cells within the female breast at puberty and during pregnancy results from physiological hyperplasia. Pathological hyperplasia occurs after injury or infection, and it is normally reversible. For example, after a normal menstrual period, hormones are released to develop the lining of the uterus. If these hormone levels become imbalanced, endometrial hyperplasia may ensue, causing abnormal menstrual bleeding. Once the hormone levels are brought back to a normal level, the endometrium typically returns to a normal size. Metaplasia is a form of cellular adaptation in which cells regenerate after injury. Basically, during metaplasia, one cell type is replaced by another cell type that is more capable of withstanding a change in environment. Regeneration. When cells are injured, the body attempts to heal them. There are 2 processes involved in healing tissues. One is to regenerate damaged tissues with cells of the same type, and the other is to replace tissues with scar tissue originating from connective tissues in the damaged area. The replacement of damaged cells with identical cells is known as regeneration. The placement of damaged cells with identical cells is known as regeneration. In pathological regeneration, cells other than the originally damaged cells replace the damaged tissue. In the example of damaged skin, a large area of damage may not be repairable through physiological regeneration of normal skin cells, so connective tissue under the skin may reproduce and repair the damaged skin. This is how you get scars. Structural abnormalities and birth defects. So we go through spina bifida is the structural abnormality that results in the failure of the fetus's spine to close properly during the first month of gestation. It's accompanied by developmental insufficiencies of the brain, spinal cord, or meninges. Infants with spina bifida may have an open lesion on their spine along with damage to the nerves and spinal cord. Even if the opening can be surgically repaired, the nerve damage is usually permanent and results in paralysis of the legs. In cases of spina bifida with no opening of the spinal cord, there may be absent or structurally damaged vertebrae and nerve damage. Limb deformities. Amelia, like Amelia, is a birth defect resulting in the complete absence of an arm or leg. Hypoplasia refers to underdevelopment or incomplete development of tissue due to increased numbers of cells. Although it can affect any organ or tissue in the body, the term typically applies to the bones and muscles of the lower legs or those of the forearms. Whereas hypoplasia is the incomplete formation of underdevelopment of a tissue or organ, aplasia refers to an absence of cells. Remember, whenever the letter A is there. Aplasia refers to an absence of cells that leads to incomplete formation of limbs or organs. In cases of aplasia, the most commonly affected bones are the fibula, radius, and ulna. The absence of the bones in the limbs can result in a shortened or bent appearance of the limbs. Phocomelia is a congenital condition in which proximal portions of the limbs are poorly developed or missing. Polydactylism is a fairly common birth defect defined as the presence of one or more extra fingers or toes. Down syndrome is named after J. Langdon Down, a 19th century British physician. It also goes by the name of trisomy 21. It received its alternate name because people with Down syndrome have an extra chromosome, usually number 21 or 22. The typical number of chromosomes in the healthy human DNA is 46 from the male sperm and 23 from the female egg. Mental retardation in Down syndrome occurs in Down syndrome to varying degrees. Note the term mental retardation is being used here in its medical sense, which is a suggestion of a slowed function of the brain. The term mentally disabled is preferable to retarded in social settings. The following signs of Down syndrome are observable in the child in color plate 10. Sloped forehead, small ear canals, gray or light yellow spots around the iris of the eye, flat nose or absent bridge, low set ears, dwarfed physical appearance, short broad hands with a single palmar crease. Down syndrome is the result of a genetic mutation. Although it has not been related to environmental factors, it has been linked to mother's age. Cystic fibrosis. Cystic fibrosis, or CF, is the most common fatal genetic disease in the United States. Cystic fibrosis is caused by mutations in the cystic fibrosis transmembrane regulator gene. The protein associated with this gene should allow cells to release chloride and other ions, but in CF, the cells are defective and do not release the chloride. The lack of chloride results in a salt imbalance in the cells. The defective cells produce a thick, sticky mucus that clogs the lungs, leads to infection, and blocks the pancreas. In addition, the presence of this thick mucus stops digestive enzymes from reaching the intestine, where they are required for proper digestion. Hernias. Although hernias may appear at any time in life, some people are born with congenital hernias. A hernia is the protrusion of an organ through the wall normally containing it. Two common sites of hernias are in the groin and in the diaphragm. Hernias tend to occur in the groin because the abdominal organs place a great deal of pressure on the muscular wall of the superior aspect of the pelvic cavity. If the abdominopelvic wall is weak at birth, a hernia known as inguinal hernia may occur. Hernias also tend to occur in the diaphragm. The diaphragm separates the thorax from the abdomen. and if the diaphragm is weak at birth, organs such as the stomach may protrude superiorly into the thoracic cavity. Hernias in which the stomach protrudes through the esophageal hiatus of the diaphragm are referred to as hiatal hernias. Both inguinal and hiatal hernias can be treated surgically. Inflammation. The causes of cellular injury elicit a complex process of defense and repair within the tissues known as inflammation. Inflammation is an immunological defense against injury, infection, or allergy marked by increases in regional blood flow, immigration of white blood cells, and release of chemical toxins. Inflammation is one mechanism the body uses to protect itself from invasion by foreign organisms and to repair tissue trauma. It may produce systematic fevers, joint and muscle pains, organ dysfunction, and exhaustion. Basically, inflammation is the body's attempt to contain and eliminate the initial cause of injury to cells. Most of the signs and symptoms associated with inflammation are the result of increases in the volume of fluids present in the tissues. One way that the body increases the amount of fluid in the inflamed tissue is through vasodilation, which is the increase in the diameter of vessels. Vasodilation, the increase in the diameter of vessels. Causes of inflammation. Inflammation can be caused by physical irritants, chemical irritants, infectious agents, or immunological reactions typical of autoimmune disease. Table 5.2 describes the various types of inflammation. Each of these types of inflammation begins as acute inflammation. Acute inflammation is characterized by being short in duration, lasting only a few minutes to a few days. Acute inflammatory processes attempt to regenerate tissue and restore them to normal function with no residual effects. If complete resolution is not possible due to the extent of the injury, scar tissue may form to fill the void left by the damaged tissue. Acute inflammation may progress into chronic inflammation. Chronic inflammation differs from acute inflammation in that chronic inflammation can last from days to years. And we will pick back up with processes of inflammation.